My name is Isita Magona, aka Stowfresh, as some of you may know me for Stowfresh Productions. I am the CEO and founder of the Mariama Sannoh Foundation for breast and pancreatic cancer. Cancer is a topic that is very near and dear to me. As the only child of my mom, it really took me a while for me to be able to sit and tell the story and even have the courage to create this foundation so that I can be able to help other people that have been affected by cancer or have lost their loved ones to cancer. Today, cancer is the second leading cause of death in the world, and this is after cardiovascular disease. And it has affected so many people, especially some of us, our loved ones. I never imagined living without my mom, especially being an only child. She was my rock, my world, my best friend, my everything. I'm glad that at least I have the courage to create this foundation, even though it's so painful for me. I'm still mourning my mom. I'm still going through grief. It's only by the grace of God that I make it on a day-to-day basis. But being that my mom was a philanthropist, my mom is somebody that actually loved to help other people. And I will elaborate on that more. Mariama Sannoh, which is my mom, is the eldest daughter of 11 siblings. She was a spiritual healer. She was prayerful. She loves her siblings. She always liked to give her best to other people. And everyone that I've met and known my mom, she is either their sister, a mentor to a lot of people, and she was a prayer warrior. She prayed for a lot of people. Sometimes when she prayed for certain people and I see that they don't like her or appreciate her, I ask her, Mom, why are you doing this? She said most of the time her reply is like, I'm not doing it for them. I'm doing it for God. And that is the legacy I want to carry. Because the night that my mom passed, I could see in her eyes there is so many things she wanted to say to me. So many things she wanted to tell me. But at the same time, this is really hard for me. I knew it was time. It was time for her to go. And while I was holding her hands and she was blessing me, I could feel the transfer of powers. And that is something I couldn't really explain to people that were around me, but it was magical. And I'm glad that I was there to witness her passing, and I gave her a befitting burial. I will miss her because she was my best friend, and she's someone that knew me inside out. And I'm glad that I'm able to share this aspect of my life with you all. So I've given you a brief history about my mom. So the Mariama Sannoh Foundation came to me that given my mom is a philanthropist, she was a spiritual healer, she prayed for people. A better way to carry on her legacy and to be able to give what she wants to others is to create this foundation. A foundation that can be able to help people that are in the same capacity, that are affected by cancer, to be able to help them, whether it's providing sponsorship through funds, sponsorship through chemotherapy, sponsorship through counseling, nutrition, and so many other aspects is the reason behind creating this foundation. It says charity begins at home. And for me, that charity is going back to my home, Sierra Leone. As you all know, I was born and raised in Sierra Leone. Now, to give you a little bit of history about Sierra Leone, Sierra Leone is a small country on the Gulf Coast of West Africa, and it's surrounded by beautiful hills and mountains on the west side of the Atlantic Ocean. The population of Sierra Leone is estimated to be between 8.52 million and 8.79 million people. That is a lot of people for that small country. And it is known as one of the populous countries in the world. And it is the second poorest nation in the world. As you can imagine, cancer victims, they're not only affected by cancer, which is one of the deadliest diseases in the world, but they are affected by poor nutrition or poverty overall. And sometimes they are unable to even afford their medical needs, or better yet, even their day-to-day needs. Now, mind you, Sierra Leone is also a country that have a lot of educated and talented individuals as myself. But at the same time, since charity begins at home, I want to use this organization to start sponsoring from my mom's birthplace in Kenema and create a domino effect around the other rural areas of Sierra Leone and be able to use that to help cancer victims and their families to live a dignified life. I have partnered with one of the oncology doctors in Sierra Leone, but he's stationed in Kenema, to be specific, Dr. Augustine A.D. Tarawali. And thank you to Dr. Augustine. He was able to provide an overview of how the entire country of Sierra Leone is affected with cancer. So to dive into this a little bit more, to give you a little bit of background on everything, he provided a brief history. Freetown, the capital of Sierra Leone, is only staffed with 4 oncology doctors, and we have limited laboratories or labs that can test for cancer. Dr. Augustine was able to come up with a proposal, a medical proposal that he wrote, so that way we can provide the help that the Kenema Government Hospital needs and also the need for the country as a whole. I have posted this information in our blog portion. So that will be the first blog of the Mariama Sannoh Foundation, and it was written by Dr. Augustine A.D. Tarawali, and you'll see his credentials there. Thank you so much, Dr. Augustine. We appreciate you as the Mariama Sannoh Foundation for everything that you're doing and everything you've done for our cancer patients over there. So I'm going to go ahead and elaborate on the different areas of sponsorship that the Mariama Foundation is looking forward to sponsoring cancer victims. The First aspect that we would like to look at is the sponsorship of the diagnostic process, which is the process of when the doctors determine if somebody has cancer. And it is also known as oncology. Oncology is actually unavailable in most parts of Sierra Leone, and especially Kenema. And the process of histopathology, which is actually where the doctors determine if whatever they've taken out of your body, a specimen, is diagnostic as or is considered cancerous, it's done only in Freetown. So you can imagine if someone comes to the hospital in the rural areas, for example, in Kenema, they have to do something and then send that out to the lab in Freetown. That's how hard it is for them. And Freetown is only staffed with 4 oncology doctors and some trained and pharmaceutical staff. The diagnostic process is long, it is expensive, and most times these labs, the specimens are taken to external labs. The hospitals there don't have the facility or capability or the equipment to be able to properly diagnose the types of cancers that people have. Result is cancer, mostly depending on the clinical and pathological stage. Sometimes doctors do a resectable surgery where they remove the tumor or cancer from the patient, or they can provide treatment if it's not something that they can perform surgery. The next section is the sponsorship of oncology drugs. As we all know, as I explained prior to this portion, Sierra Leone has no established national oncology program. The country at large lacks proper drugs or even chemotherapy for cancer patients. There are limited oncology drugs available for cancer afflicted patients. Most patients at healthcare facilities, they only come to these facilities when their cancer is at an advanced stage. And I can only imagine, because for me, my mom had always complained that she had a lump in her breast. And it's something that she thought it wasn't cancerous, it's just a lump. Growing up as a little girl, her mother, my grandmother, will always tell her, it's okay, when you have kids, that lump will go away. And we know our people, sometimes when they were growing up, they were not as advanced as we are now, as we are knowledgeable to know that we know our own bodies. When we have things in our lumps, when we feel a certain way, we make an appointment and go see our doctor and they'll check it out, and we can detect things that are wrong within us at an early stage. She didn't know it was cancerous, and she had carried that lump for years. Sometimes it will hurt, and sometimes it will not hurt. So, continuing with the topic of sponsoring oncology drugs, a lot of people only show up to the hospitals when their cancer is at an advanced stage. And sometimes some of them are scared. They don't even know what they have. They don't even know if it's cancerous. They don't even have the finances to go to the hospital for their basic needs. So these people really need our help. They need your help. I want the Mariama Sannoh Foundation to serve as an advocate where we can be able to sponsor and help these people. They need our help. And there are people out there, it's really sad to see what they're going through while they're going through cancer. Sponsorship of surgical equipment is the next project that the Mariama Sannoh Foundation is working on. According to the Lancet, the estimated unmet surgical burden of diseases in Sierra Leone is huge. There is a historical neglect of surgical care, both nationally and globally, and it has made it nearly impossible for doctors to provide proper care. Approximately 4 million people lack access to emergency and essential surgical care. And most of these needs are in our rural areas, for example, Kenema. The lack of surgical treatment or surgical care has taken a toll on human and economic lives of people. The lack of surgical care has taken a toll on human lives. The country, Sierra Leone, presently lacks radiotherapy facilities, but they are successfully managing cases by performing local surgeries. Another area of sponsorship will be sponsoring the training of cancer hospital staff. Nurses and pharmacists don't have the formal training in cancer care. Majority lacks the expertise of applying oncology drugs to cancer patients. And as a foundation, we would like to provide proper care, proper education for these healthcare workers. That way they can serve cancer victims better. My mom was going through chemotherapy and going through treatment for cancer. We had access to a counselor that not only came to our house and spoke to my mom. We had counselor at the facility where she was receiving care, and so many other different people in addition to the doctors that were providing treatments to her, the nurses. So we want to provide that same type of care for individuals with cancer that are affected in Sierra Leone. Aspect of sponsorship that we would like to provide as a foundation is to be able to provide counseling for cancer victims. Sometimes when people go through cancer, especially for me, firsthand experiencing that with my mom, she had a counselor and also a support system, which was me and some of her immediate family members, talking to her on a daily basis about positive, encouraging words to help her carry on her treatments with cancer. Organization, we would like to provide the same care, counseling for cancer victims in Kenema and Sierra Leone at large. So we are asking if you are a counselor, you have expertise in sociology, and you are able to counsel cancer victims in Sierra Leone, please come on board and join the Mariama Sannoh Foundation so that way we can provide the proper counseling, care, and needs these people need. Our motto as a foundation is that we want to provide relief for the poor, vulnerable, and underprivileged cancer victims. And we're going to start doing that in rural areas, in areas where people are not even able to provide their basic needs. They are not able to provide their daily food on a daily basis, nutrition on a daily basis. We want to be able to go there and change that for them.
The following pictures are just some of the sponsorship that the Mariama Sannoh Foundation has completed at the Kenema Government Hospital. We have provided care in all of those areas that I have mentioned, starting from the diagnostic process, sponsoring the doctors, sponsoring the cancer patients, and providing nutrition for them. Some of the core volunteers of the Mariama Sannoh Foundation is myself, Mr. Andala Jeng, who has lent his expertise to the foundation, Mr. Mariama Sannoh, that has also lent his expertise in journalism to the organization, and finally, Mr. Musa Kamara. The organization would like to say a big thank you to Mr. Musa Kamara. He has lent his expertise as a project manager and coordinator by coordinating and linking us with doctors in Kenema and providing these pictures that you see here from cancer patients and also from the doctors in the city of Kenema. Once again, thank you so much to Mr. Musa Kamara.
Our motto as a foundation is that we want to provide relief for the poor, vulnerable, and underprivileged cancer victims. And we're going to start doing that in rural areas, in areas where people are not even able to provide their basic needs. They are not able to provide their daily food on a daily basis, nutrition on a daily basis. We want to be able to go there and change that for them.
We have some strategic donors that have already come on board to support the Mariama Sannoh Foundation. You will hear from these donors in our future podcast post. To read more about what they have done and how they have contributed towards the Mariama Sannoh Foundation, please visit the Mariama Sannoh Foundation at www.mariamasannohfoundation.org.
Sannoh Foundation is primarily located in the United States here, and we're going to establish branches in Freetown, Sierra Leone, and also in Banjul, the Gambia. And it is upcoming because my mom's older brother lives in Banjul, the Gambia, and we will be expanding the foundation there very soon. We'll be launching there very soon. But this is our first project sponsoring the hospital in mom's birthplace in the city of Kenema, Freetown, Sierra Leone, Sierra Leone as a large. This will be our first project, and we will create a domino effect, like I said, by sponsoring other hospitals surrounding the rural areas and also sponsoring Cancer Hospital in Freetown. All my fellow sisters out there, black, brown, white, it doesn't matter where you're from. Go and do your checkups. Do your mammograms. Take care of yourself. Exercise. Live a healthy life. If you feel something different in your body, consult your physician. Consult your doctor. We only have one life to live, and you want to make sure that you live it to the best of your ability, or you're there for your family, your kids. I want to be here for my kids as long as I can. So I'm going to do the right thing. If you are a man, take care of yourself. There are a lot of men that have prostate cancer and so many other related cancer diseases, colon cancer, and so much more. So please, 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 I am asking everybody, be conscious about your health. Take your health serious. Exercise, eat right, know what you put in your system. And trust me, you'll be able to live a good life. Thank you all for watching, and I hope that you can be able to spread this around. It doesn't only apply to Sierra Leoneans or to Africans from Sierra Leone or to Africans in my community. This applies to all Africans in the diaspora, whether you live in the United States, United Kingdom, Australia, Canada, any part of the world, or even back home in Sierra Leone. We're asking you to join our team, become a volunteer. Join the Mariama Sannoh Foundation so that we can bring awareness to cancer victims. There are so many other projects that we have coming up, so many other podcast episodes that we're going to talk about topics that are related to cancer and how you can benefit from it and how we can benefit from it as an organization and be able to help others. Please click on the donate button below this video. Support our cause to help cancer afflicted victims in areas that they are not able to get the treatment or proper care that they deserve. Thank you once more. As the CEO and founder of the Mariama Sannoh Foundation, I want to say a big thank you to you for watching this and for listening to me to tell my story.